Lauren Alving.
Here.
Kim Barrett.
Present.
Dan Bernal.
Present.
George Blumenthal.
Here.
Michael Botchin. Linda Boxer.
That's your
Leandra Clark Harvey.
I'm here.
Deborah Deese.
Here.
Anne Marie Dulege. I see Anne Marie. I'm going to mark her present. She's talking to someone. Isabel Duron.
Here.
Mark Fisher Colbury.
Here.
Fred Fisher.
Here.
Elena Flowers.
Present.
Judy Gasson.
Here.
Larry Goldstein.
Here.
David Higgins.
Here.
Steve Julesgard.
Here.
Rich Lahara. I saw Rich. Oh, there you are. Thank you. Pat Levitt. Linda Malkus. Dave Martin.
Here.
Shlomo Melmed.
Here.
Christine Miaskowski.
Here.
Lauren Miller-Rogan.
Here.
Adriana Padilla.
Here.
Joe Panetta.
Here.
Al Rolette.
Present.
Barry Selleck.
Here.
Michael Stamos.
Here.
Jonathan Thomas.
Here.
Art Torres.
Here.
Christina Vori.
Here.
Carol Watson.
Here.
Thank you. We have quorum.
Thank you. Al, are you in Germany?
I am JT. I'm in Berlin, Germany, in Lichterfelder State.
Exceptional dedication. Thank you for phoning in. We appreciate it.
I'll apologize in advance for my Wi-Fi connection here if I have to get off, but I'll do my best to stay in the meeting. Thank you.
Thank you very much. So the first order of business, as you all may have noticed, we had two new members on the roll call here. I'm going to ask if they can introduce themselves, starting going in alphabetical order. Dr. Lauren Alving from UCSF, Fresno. Lauren.
Thank you, JT. I'm Lauren Alving, and I'm a cognitive and behavioral neurologist from UCSF Fresno. I run the UCSF Fresno Alzheimer and Memory Center, and I also am the director of the SJV Prime Medical Student Program, which is a track of the UCSF Medical School where the students spend their clinical years in the San Joaquin Valley. Thank you.
Thank you. And next, Dr. Kim Barrett from UC Davis.
Good morning, everybody. Very pleased to be here. I'm Kim Barrett. Since last month, was appointed as the Vice Dean for Research at the UC Davis Medical School. Prior to that, I spent 36 years at UC San Diego in the medical school as a faculty member. I'm a gastrointestinal physiologist by training and inclination. As I said, I'm honored to be serving on this board.
Thanks very much. We will start here with a chair's report. As everybody knows, post-November 2020 and the successful passage of Prop 14, we very quickly ramped back up and have been going full speed ahead for the last year. Those of you who've been directly involved know that we've had the GWG has been extremely active. We've had 16 meetings over the course of the year, 10 CLIN, 2 TRAN, 2 DISC, and 3 educational reviews, which have ended up awarding at this point $282 million worth of grants, not counting the 2 that are on today's agenda for your consideration. It's been a very busy year for review. Dr. Sombrano and team have done their usual stellar job in teeing up all of that and allowing us to get back into full swing very quickly. The board, of course, has been very active. We've had I believe, 13 meetings, counting this one, maybe 14 if you add in things like the scientific strategic advisory panel session, et cetera, which, as you may recall, was back in February, which brought together an all-star cast of advisors from the stem cell world outside of California to help advise the agency as it was contemplating the development of the strategic plan that is next up with Dr. Milan on the agenda. We had a manufacturing workshop that Shyam Patel and others put together. It was very successful. We had Bridges program, the Spark program. We've been going full bore. We've, as you will hear, ramped up the members of the team, having downsized last year, not knowing what the results were going to be of the election, and continue to add best-in-class people to the team overall, which continues to function under Dr. Milan at an exceptional and professional rate. We had in November the annual meeting with the State Controller's Oversight Group called the CFAOC, or Citizens Financial Accountability Oversight Committee, at which our Director of Finance, Pune Simpson, presented the State of the Union with CIRM's finances and budgets, et cetera. And Dr. Milan presented on the progress that CIRM has made over the course of the last year, which has become an annual highlight of that meeting. The committee is always very interested to hear what we have funded and the progress we've made, and the relations with the committee are great, and everybody does a wonderful job at that meeting. And that brings us to today. So it's been a very, very full year. Obviously, COVID continues to make things difficult logistically. One of the very few silver linings of that is because nobody has to, or indeed can, travel for a variety of reasons. We've had tremendous participation by the board, which is something that we hope we can continue as we move into 2022. So with that sort of brief summary, I want to get to the main point of the the chair's report, which is we have a very distinguished guest on, who is Oz, who is come here to today's board meeting so we can properly celebrate his tenure as the longest standing member of the CIRM board in its history. And we have a resolution, which, because it's so impressive, I'm going to read in its entirety for Oz, and then we'll ask for folks to comment. So if you'll just bear with me here, I'm going to read this resolution. Whereas Oswald Stewart received his Bachelor of Science in Psychology from the University of Colorado Boulder in 1970, whereas Dr. Stewart received his PhD in psychobiology from the University of California, Irvine in 1974, whereas Dr. Stewart served as a professor in the Department of Neurosurgery at the University of Virginia School of Medicine from 1974 to 1986, whereas the NIH recognized Dr. Stewart's early work by awarding him with the NIH Research Career Development Award, whereas Dr. Stewart served as a professor of neuroscience and neurosurgery at the University of Virginia from 1986 to 1989, whereas Dr. Stewart served as the founding chair and Harrison Foundation Professor of Neuroscience and Neurosurgery at the University of Virginia from 1990 to 1999, whereas Dr. Stewart was the co-recipient of the OASI Institute International Award for Brain Dysfunction Research in 1991 and received the National Alliance for Research on Schizophrenia and Depression's Distinguished Investigators Award in 1998, Whereas Dr. Stewart serves as the endowed Reeve Irvine Distinguished Professor of Anatomy and Neurobiology and holds joint appointments in the departments of Neurobiology and Behavior and Neurosurgery at the University of California Irvine School of Medicine. Whereas Dr. Stewart is the founding director of the Reeve Irvine Research Center, a world-renowned basic science research center devoted to the study of repair, regeneration, and recovery of function after spinal cord injury at the University of California Irvine School of Medicine. Whereas Dr. Stewart is well known for his research on how nerve cells create and maintain their connection with each other and how these synapses are modified after injury. Whereas Dr. Stewart is president-elect of the Society of Neuroscience, the largest neuroscience professional society in the world. Whereas Dr. Stewart is a member of the American Society for Cell Biology and American Association for the Advancement of Science. Whereas Dr. Stewart served on the Council of the Society for Neuroscience from 2013 to 2017. Whereas Dr. Stewart was a founding director of CIRM, helping establish the agency's foundational procedures and policies, and serving in leadership roles throughout his tenure on the board, including as co-chair of the Grants Working Group and the chair of the Science Subcommittee. Whereas Dr. Stewart, through his experience, commitment, knowledge, and leadership, contributed greatly to the momentum of discovery and the future therapies, which will be the ultimate outcome of the dedicated work of the researchers receiving CIRM funding. Be it resolved that the governing board of the California Institute for Regenerative Medicine, on behalf of the people of the state of California, wishes to express its deepest gratitude to Dr. Oswald Stewart for his service on CIRM's governing board and for his dedication to the advancement of stem cell research and to the mission of CIRM to accelerate stem cell treatments to patients with unmet medical needs. Oz, exceptionally impressive litany. And before I give some comments at the end, I wanted to see if a few others on the board would say a few words in your honor. So who would like to speak up on Oz's behalf here? Let's see, Judy.
Thank you very much. You know, the old saying is that no one is irreplaceable in an organization, but from my perspective, it's going to be incredibly difficult to replace my colleague, Dr. Stewart. I don't know how he was able to do all of the things he was doing at Irvine, in the ICOC, in his own research portfolio, and still play such an incredibly impressive role in the GWG and in the Science Subcommittee. And I learned a lot from listening to you. And what I would say is that, you know, we're an organization that knows where we're trying to go, but occasionally we're not quite sure how to get there. And every now and then a kind of an exciting debate will break out about whether we should do this or do that or do the other thing, which is extremely healthy and it's really good for the organization. But usually I would wait for Oz to raise his hand. And then Oz would be very calm and very collected and very thoughtful. And he would say, well, he was very wise. And he would usually come in with what I considered to be a very creative resolution that would accomplish the goal that we had all agreed upon, but might take a slightly different path from what we were talking about. So it's really been my pleasure to know you, Oz, and to serve with you on this board, and really best wishes going forward, and congratulations on all of your accomplishments.
Thank you, Judy.
Sure, I'd like to go after Judy.
Sure, Deborah.
Okay. Yes, so Oz, it's really been such a pleasure working with you over the years. I've been on the board now for 5 years, and just to hear your voice within the various consultations or discussions that we've had on the board brought new light. What I really enjoyed and admired about you is that you are, you truly represent the spirit of true consultation. And what I mean by that is that when things arise and we put issues on the table, even if you place them there, you don't take them personally. And so often in the consultation, you may change your mind and go with what is best or what you see as the right, proper outcome for the team. And if so many of us can just aspire to consult that way, things would be so much better and the world would be a better place. I wish you the very best, and we will miss you. And hopefully we'll be calling on you in one form or another.
Thank you, Deborah. Joe, you're next.
Thanks, JT. Oz, I wish we could be there in person to properly send you off, and I wish I could be there to shake your hand and thank you. I've been engaged with CIRM since I think the day Larry Goldstein called me back in 2004 and said, we've got to go up and talk to this guy who's got a proposal to create a stem cell agency and get behind it. And you've been involved in it for a long, long time. But, you know, to add to what we've just heard, from my perspective, there are a lot of eminent MDs and PhDs, researchers on this ICOC. And then there are those of us who are not, or who are junior scientists with master's degrees, who don't always understand the entirety of the discussion around some of the science that we have to make decisions on. And you're the guy whom I've always waited to hear from because of your clarity and your inquisitiveness, and because you ask the questions that I wish I could come up with myself sometimes. And then I rely on you to ensure that we get some of the answers that I need to help to make decisions. So from one of the non-scientists on the committee, I just want to thank you and tell you how much gratitude I have for your leadership and your stability throughout all the time that I've been on the ICOC and that you've been on the ICOC. So thanks. And I know that you've got a lot ahead still. So best of luck. And in the short tenure that I have left on this committee, I'm going to miss you a lot.
Thank you, Joe. David?
Yes. Well, so much has been said. All of it true. But so I was trying to think of maybe if you could take distill everything that Joe and Deborah and Judy said and distill it into one word to describe Oz and his contributions to CIRM, what would that word be? And the word I came up with is integrity. I think that Oz embodies integrity, not only in the way he practices science and technology, but the way he interacts with other people. He treats everyone with respect and values everyone's opinion, and has proven the old saying, at least where I grew up, that you can attract more flies with honey than with vinegar. And honey to Oz is his respect for his coworkers. So I'd like to echo everything you've heard and add to that you bring all that together in one package. And thank you for applying those skills to our cause and our needs, and you will be missed terribly. Thank you.
Thank you, David. Christina?
Well, so many things have been said, but so I need to come up with something I think a little different. So in every Marvel movies, there are superheroes, and after they have saved the world several times, just like Oz has done for CIRM, it's time to go to the beginning of times and to the origin of the story. And there we find Oz, I think, again. the beginning of the superhero saga of the CIRM universe. And you truly have been there, as Joe noted, even before CIRM came about, and then from very beginning, and really contributed in immense ways to the success what CIRM is today. Remember in the earlier days with the programmatic review as part of the grants working group, I think you co-chaired this with Jeff. And looking back, I think that was a very important time when it was not only the science that CIRM had to really pay attention to, but also the programmatic evaluation and balance of what CIRM is doing, so that we as an agency are truly for all Californians, not something that's fancy or sexy at any given time, but truly look at very broadly how CIRM can have impact for everyone. So you have been absolutely instrumental in doing that. We had at some point in time a really fun process called extraordinary petition. This is, I think, the time where many of us were waiting for you to speak before we entered into the battlefield. There were scientists who, some asked nicely whether we would reconsider their grants, others demanded their applications to be funded regardless. And we heard really very touching stories from patients and patient advocates who knew that CIRM might be the last hope, or at least at that time for them. These were very emotional times, and you were always the very rational, very calm voice who clearly articulated what made sense, and more importantly, why it made sense. And it was very, very easy to follow your lead at those times. And so I wish you all the best. I know you are going to continue to be superhero wherever you are next, and probably have a great time. Also, I hope a little bit outside of work. You have deserved that.
Thank you, Christina. Art.
Yes, Oz is one of my favorite members, and the reason why term limits is such a frickin' mistake. Here, because of term limits, we've lost a lot of great people, but on the other hand, we got rid of some real wackos too over the years in the legislature and other places. But the fact of the matter remains that Oz was a very important pioneer on our board. And not only does my experience with him working in the grants working group, but also outside of CIRM. And it was always a pleasure as we were upstairs in the Claremont Hotel to see this championship swimmer swim the laps at the Claremont pool, but also more importantly, what a stamina. And number two, I just want to thank him again because he is the best reference for great Mexican restaurants in Laguna Beach. And he found those all the time with his incredible wife as well, who's an incredible artist. So Oz, I will miss you, but I'm sure we will be in touch. Take care, my friend.
Thank you. Michael?
Thank you. Yes, at the risk of being told by Maria that I have a conflict of interest, I had to say a few words about Oz. I'm glad to see that the rest of the world has discovered what we've known for a couple of decades at UCI. And I think the one word I would add in there, and not to be too wordy here, is selflessness, because Oz has achieved all those great things and has contributed greatly, sometimes at the expense of his own interest, if you would. So thank you for that, Oz. And by the way, he's not going anywhere. He's very busy back at UCI. So thank you, Oz.
Thank you, Michael. Steve?
Yes. Well, first of all, I just would really like to thank you, Oz, for being there all those years that we've overlapped, the 11 years that I've been on the ICOC so far. You have always been the voice of reason, the voice of finding a solution, the voice of compromise. I can't really add a lot more to what's already been said, other than I've always appreciated what you've had to say with the way you thought about the world. We didn't necessarily always see eye to eye. We did most of the time, but we had our differences. But nonetheless, I have a great deal of respect for you and for what you brought to CIRM. And again, just thank you for being such a great board member.
Thank you, Steve. And I'll add a few comments here as well. So Oz, when I think of the word that I would use to describe you, it's actually three words from the standpoint of what you brought to CIRM, which are the total package. And by that, I mean, you were able to combine scientific expertise with procedural rigor. You always kept us on the straight and narrow, doing things just exactly as they should be approached. And you brought at all times the empathy of the patient advocate, which is at the core of CIRM's mission and everything that we are all about here. And you blended them together, all of those traits seamlessly in a way that made you not only somebody to whom everybody turned, but you did it so effortlessly and with great grace, and were somebody that that immeasurably advanced the ball of CIRM as it marches down the field of our grand experiment. You were somebody when I started in 2011 that I immediately turned to as somebody who could help teach me the ropes of things that were important to the organization. Got to watch you firsthand, not just on the board, but most impressively as well in the GWG, where your scientific expertise was brought to bear time after time, and you were able to interject very meaningful comments that helped in the deliberations that body undertook, regardless of what type of grant was on the line. We've had talks over the years when you were heading up the science subcommittee with Jeff, that you were able to set the direction for the scientific and research award elements of what we do, which of course is the biggest single thing, and did so by spending enormous amounts of your time and energy, and all very much appreciated. So when you add it all together, Oz, for me, you were the total package on the board, and I echo what everybody said, which is we so appreciated everything you did for the ICOC, for patients everywhere, and for the citizens of California whom we are representing. So thank you so much. And with that, Oz, I will turn to you for a few comments.
Oh no, I think he disappeared.
No way.
I think he did. Oh no. But Isabel has her hand raised, so maybe Isabel can say a few words till Oz gets back on the line.
Ultimate mic drop.
Yeah.
I know.
Actually, I was just raising my hand to clap for him.
Oh, okay. Sorry.
I knocked him off the radar. But if maybe he can hear us, but if he can't, nonetheless, I'm very sorry that I didn't have more time to spend with Oz, and most of it in the box and not in person, because with all of the experiences I've had with him, I find him to be a most gentle soul, and I appreciate his empathy and his intelligence. So I hope we get him back, if nothing else, to have a final goodbye there. And maybe
just reached out.
I wonder if he heard any of that.
No, he did. He froze up at the very end. So I know that he did hear most of it. I was watching. But he's not on.
We can always send him a transcript.
And send him the YouTube version.
Right.
Well, then I'll add a song or something.
Okay, let's
JT,
hurry up.
I would probably move and to the motion, and then if he comes on later, we can do something then.
Okay, so we have a resolution here, which, as you know, I just read. And I believe we want to approve that resolution as a board. So do I hear a motion to approve?
Move to approve.
Moved by Senator Torres,
Second,
seconded by, is that Isabel?
yes.
Yes. Maria, I don't know that we need to call a roll on this one. I think that
Okay.
I think we know the answer on this one.
All righty.
Unless Kevin tells me we have to take the roll. I think
No, he's fine.
we'll record a unanimous
Yay.
rousing approval for this and hope that Oz gets back on.
I see that he's just joining now with his iPhone, so it'll just be a couple seconds for him to get access.
Okay. We will wait then.
He's on. Oz, are you on? If you're on mute. Oh,
I
nope.
am.
Oh, there you are.
On.
Uh-oh.
Oh, we can't hear you.
Yeah, Oz, you're.
Is he in Germany? No,
He's playing a sitar.
I think the bandwidth is not enough for the video.
Yep.
Is that George Harrison coming in, or is that?
Oz, if you turn off your camera, we might be able to hear you.
Muted.
Are really?
Oh, he's here.
Let me see.
Yeah, Oz,
No.
we can't,
So-
we're getting about every 10th syllable.
Well, our electricity went off.
There you go.
Yeah. I think, perhaps that was a message from someone saying, oh no, that none of that wonderful stuff you were saying could actually be true. I'm so deeply honored by everything that everyone said. I miss you guys so much. It's been such a wonderful time serving on the ICOC. I have to say that I was both extremely honored and grateful, but also grateful to Maria that she kept a straight face when people were commenting about my rationality and calmness. She knows otherwise, but that's okay. Just because this is so awkward without electricity, I won't say all the things I want to, but I do want to say it's such a wonderful completion of the circle that Rich Lahara was appointed as the incoming representative patient advocate for spinal cord injury. Some of you may know that Rich was, of course, the first recipient of any stem cell. It was actually a product of Geron that came from research at our center here at UC Irvine, Hans Kiersted's research. And it's just fantastic that Rich is now there. I just want to say how wonderful it was over the years to serve an amazing group of people. Everyone, I look back on the early days and all of the other patient advocates who served so honorably and so long, and every one of them served selflessly, but always with due respect and consideration for what was really important in terms of the fact that we were also a state agency, and they were all conscious of the fact that we were spending taxpayer money. And those two things together, I think, represent what is the true strength of CIRM going forward. Looking back, I think it is sad that some of the things we thought we could do.
Oz, you're breaking up a little.
Weren't able to accomplish we haven't really seen very much progress in terms of, is something that we all thought would be an early. Okay, sorry. Am I better? We have zero power down here, folks. It's the wind is very high here. So I'm just going to stop. And It's too awkward to try to say all the things I want to say here, but I just want to
We
actually
hear
say
you, Oz.
thank
We
you
hear
to
you.
all of the new members. CIRM is in great hands with you. CIRM is in great forward. Thank you all. And I'll stop rather than trying to continue here with bad connection. Thank you.
Oz, I don't know if you're still on, but we heard most of that, and sorry for the power situation down there, but just know how grateful we all are, and we absolutely will miss you very much. So thank you again for everything. Okay, that concludes the chairman's report. And next on the agenda is the president's report. Dr. Milan.
Thank you so much. Doug, if you could please display the presentation. Thank you, Chairman Thomas, members of the board, members of the public, and CIRM colleagues. It's with great enthusiasm that we bring CIRM's new 5-year strategic plan for board consideration today. With the resolution and honoring of Dr. Oz Stewart, I thought it was appropriate to remind us of a quote. If I've seen further, it is by standing on the shoulders of giants. And I believe that we are in an extremely strong position with this new strategic plan because of you as current board members, past board members, and the founding members of CIRM. One second here. Next slide, please. So arriving at this plan has been extremely fulfilling. It's been an extremely fulfilling endeavor, and in every aspect was a team effort. We have had the opportunity to engage with the board every step along the way and to gain important input from our scientific strategy advisory panel that JT had mentioned that was assembled in February of this past year, our grants working group, our California scientific, industry, and patient community. A huge thank you to this board for your support and your insightful input, most recently at the October ICOC meeting, and then at the November Science Subcommittee meeting. This has led to the final rounds of refinement and revisions that are now incorporated into the strategic plan for which we seek your approval today. You all should have received a copy of this plan electronically, and it's posted on the CIRM website. Once this plan is approved, it will give us a framework to guide program and concept and budget development in the upcoming years. So just for purposes of making sure that everybody's had a chance to review the plan and address any input or final comments, I wanted to just give a brief overview. In the first 6 pages of the strategic plan, we provide a background of where we are today. It highlights how CIRM has established a strong track record as a patient-centric funder, partner, accelerator, and de-risker for basic, translational, and clinical research, how it has created critical infrastructure and education programs. CIRM has fostered the growth of a new field in research and medicine and has built a vibrant regenerative medicine ecosystem in California with impact beyond the California borders. The next few slides are a reminder of CIRM's accomplishments and value proposition that serve as the foundation for the new strategic plan. Next slide, please, Doug. You've seen this slide before, but as a reminder, CIRM has built one of the largest portfolio of regenerative medicine programs spanning from discovery, research through clinical trials. And a distinguishing and differentiating feature of CIRM is the support of programs in the so-called translational stage, also referred to as the valley of death, where promising science often fails to get the support and funding it needs to translate into potential therapeutic candidates. CIRM has one of the largest portfolio programs going to the clinical stage with over 76 clinical trials and over 3,000 patients enrolled in these, often first-in-human trials spanning a broad range of indications from rare disease to more common diseases. And we've already seen proof of concept that single or limited administration curative intent therapies have shown durable effect in patients such as Evie and others in the ADA SKID trial, and Brendan in the X-linked chronic granulomatous disease trial that you've seen presented in our annual reports and previous presentations. Next slide, please. While CIRM is well known for funding translational and clinical regenerative medicine research, we've funded close to $900 million in investment into basic research and enabling scientific infrastructure as listed here. This is critical, as good medicine starts with strong basic science. And the new strategic plan is committed to continued funding of basic discovery and foundational science. Next slide, please. We have established a first-in-kind and extremely successful stem cell and regenerative medicine clinical network called the Alpha Stem Cell Clinics Network. And our programs are part of the new regulatory paradigm in the development of these so-called living medicines or novel regenerative medicine programs. You will see that we will build on this capacity and expertise in the strategic plan. Next slide, please. CIRM has already started to build a vibrant regenerative medicine ecosystem in California, funding education and training programs of its future workforce. It's incredible to me that when I give lectures at the various universities and sometimes outside of California, that students, extremely promising and students with bright futures ahead of them, tell me that their mentors were previous CIRM funded Bridges students or scholars. It's truly incredible that CIRM has already had a lasting impact on building the future leadership and scientific workforce in the new field of regenerative medicine. CIRM has stimulated the economy, as had been highlighted previously in the economic impact report, and has created novel partnership and investment opportunities through industry engagement, enabling over $18 billion, just most of them over the past 5 years, in industry funding into our CIRM portfolio programs. Next slide, please. Next slide, please, Doug. So everything that I just reviewed have a setup for the next era of CIRM that's been made possible by Proposition 14. They serve as a solid foundation for the new strategic plan that serves as expanded mission statement, which you'll recognize because this was the subject and topic of a lot of discussion, especially at the October board meeting and then additional at the November Science Subcommittee meeting. Accelerating world-class science to deliver transformative regenerative medicine treatments in an equitable manner to a diverse California and world. This mission statement is intended to reflect the essence of what one of the board members astutely pointed out, what a mission statement should do is identify who we are, what we propose to accomplish, and how we know we will succeed, that we have succeeded. The mission statement is on page 7 of the strategic plan. Next slide, please. The mission and the strategy that's outlined in the strategic plan and that I will briefly outline today, that we're bringing to you for approval, is bold, but we believe it's achievable. And the output of the strategic plan will leave a lasting legacy through the development of novel scientific and collaborative approaches and models, healthcare delivery models, and the expansion of CIRM's education and training programs to give rise to the leaders and scientists and workforce of tomorrow. Next slide, please. The approach that we outline in the plan will build on CIRM's proven accelerated funding model. It will enhance, organize, and interconnect the established as well as future programs that we will bring to the board for approval to achieve the strategic goals, which we organize into 3 strategic themes: advance world-class science, deliver real-world solutions, provide opportunity for all. Now I'll just go through the 5-year goals under these strategic themes. Next slide, Doug. The first theme is related to an area where CIRM has truly established its identity. It is a major funder and builder of stem cell and regenerative scientific and medical research. Next slide. In the new era, CIRM seeks to create a paradigm shift in how we support collaborative research and enable regenerative medicine, scientific research, and clinical trial development. By continuing to fund high-risk, high-reward projects while developing next-generation technology hubs, the first example of a technology hub being the shared labs as stipulated in Proposition 14, and creating systems and resources to assemble data and knowledge networks and data sharing. We believe that this will enable and extract the most value from the programs, scientific programs we fund. And this is detailed in the section of the strategic plan beginning on page 10. Next slide, please. Under theme 2, we seek to meet the challenges of a maturing field where more programs are going into the clinical stage. We are already starting to see early successes, but are understanding the hurdles in this new industry. In addition to continuing to support research and address challenges in the laboratory and in the context of controlled clinical trials, which are more limited in scope, we have our sights set on addressing the real-world challenges of bringing these technologies to marketing approval, commercialization, and adoption into the healthcare setting. This section is covered on page 15 of the plan. The 5-year strategic goals related to this particular theme address the hurdles and challenges to deliver these therapies in the real-world setting. We intend to create next-generation solutions to address regulatory and development challenges, a manufacturing partnership network to overcome key bottlenecks, and healthcare delivery infrastructure to support broad and inclusive participation in the rapidly developing regenerative medicine clinical trial space and approved treatments. To expand a bit more on this, we will deploy the integrated approach of CIRM's therapeutic development programs to address hurdles and marketing approval and post-market considerations. We're uniquely positioned to do so in a portfolio approach and assembled with a plan to have the evidence base and knowledge network. We are very well positioned to have meaningful conversations and partnerships with external stakeholders, regulators, and payers. We have a very well-established clinical advisory panel and translational advisory panel, and the team proposes to build upon this so that we can address issues that will arise later on toward marketing approval and post-market considerations, but have that built into the conversations, even in the translational stage or early clinical trial stage. Next slide, please. Manufacturing is a very well-known challenge and a major hurdle to commercialization of promising regenerative medicine. Even programs where there's some early successes in early stage trials often find a hiccup or even a major barrier to going out to final marketing approval and commercialization because there are some challenges with tech transfer out to industrialization of the process and to distribution of these programs. There's a uniform agreement of this challenge by the research community, industry, and the FDA. And to overcome these barriers, CIRM proposes to develop a public-private partnership manufacturing model that will optimize the co-development by our academic GMP facilities of approaches and standards to overcome technical challenges, advance standards, and promote quality by design principles, all of which increase the ability to create more robust evidence base. Synergies between these centers really provides an opportunity to democratize the specialization and the specialty assets of these centers, as well as to continue, iterate, and improve upon these tech capabilities. Through this type of structure, CIRM will facilitate early industry involvement and partnerships, including with our industry alliance programs for provision of services, resources, and potentially even investment into these programs. This will be designed in a way to advance standards, create efficiencies, and de-risk the path to commercialization, and to train and build a regenerative medicine manufacturing leadership and workforce, which everybody agrees at this point there is a true need for, and there is a gap in that arena. Next slide, please, Doug. Finally, the ultimate goal of all these efforts is that patients in need will receive these treatments. As stipulated in Proposition 14, we'll expand the Alpha Clinics network to enable innovative clinical research, increase patient access to trials and approved therapies, and train expertise in the delivery and care of patients in these trials and treatments with regenerative medicine. I just lost my power. Okay, can you still hear me?
Yes.
Yes.
Okay, fantastic. So I'm in slide. In addition, Prop 14 also stipulates the creation of these community care centers of excellence to be the partner organizations that will address what the patients need in the community setting in order for this adoption and appropriate access for patients, both to clinical trials and treatments. Next slide, please. Okay. So with these two initiatives of Alpha Clinics expansion and community care centers of excellence, these will be opportunities to create new models for healthcare delivery, as well as vehicles to understand what it truly takes to bring these therapies out into the world, as well as provide the setting for basic scientists to be exposed and trained in clinical research, so they, when they're doing their work, can anticipate the problem sets that may arise later, and to train clinical trial workforce, including nurses and clinical research coordinators. At one of the past board meetings, it was noted that there is a sore rarity of trained clinical research coordinators, especially in the academic centers. And to partner with professional societies to develop medicine specialty certification and accredited accreditation programs. The community care centers, which are still a concept under development, there will be an incredible amount of community engagement, input, and discussions over the course of the upcoming year, so we can best understand what the community wants and needs and how things work in the current healthcare offerings in the community setting, so that we can best develop programs to support patient referral, recruitment, and access to regenerative medicine clinical trials, education materials, and address the unique needs of the given community, as well as leverage the offerings of the Alpha Clinics and CIRM's academic institution. Through these, both the Alpha Clinics expansion and the Community Care Centers initiative, the goal is to expand engagement and participation and broad access to diverse communities in clinical research and access to the types of treatments that CIRM will move forward. Next slide, please, Doug. And finally, the third theme is provide opportunity for all. Next slide, please. So CIRM intends to build inclusive participation opportunities for all stakeholders, from students to workforce to patients. So the tenets of diversity, equity, and inclusion has been the topic of much discussion at the board level, has been incorporated into our granting process and the review process, and it's in continual and evolving development, because we are truly committed to embedding this in how we fund and support research, as well as how we track where we can do better. The goal in this thematic area is to build a diverse and highly skilled workforce to support the growing regenerative medicine economy in California, as well. And then this is a separate but related topic, is to deliver a roadmap for access and affordability for regenerative medicine for all California patients. And this is the second of these goals, is going to be largely driven by the leadership and priorities set by the Affordability and Accessibility Working Group. Next slide, please. To just touch upon the first of these goals, which is the education and training goals. CIRM has already, even with prior to Prop 14, and especially after the passage of Prop 14, has invested in significantly in education programs, as Chairman Thomas had highlighted early on in his chairman's report. And the goal is to create multiple on-ramps at multiple levels to provide access for the community, for diverse community, to enter into the field and generate leaders, scientists, clinicians, and future workforce with lived experiences in these communities, so that truly we can continue to build the trust and understanding of the communities that we serve. And in addition, these training programs will be integrated within the CIRM scientific and infrastructure programs to provide training and exposure to basic research, translational and clinical research, manufacturing sciences, data science, science communication, and community engagement. Next slide, please. So in summary, the 5-year strategic goals are to develop competency hubs and build knowledge networks in order to advance world-class science, advance therapies to marketing approval, create a manufacturing partnership network, expand the Alpha Clinics network, create community care centers of excellence, build a diverse and highly skilled workforce, and deliver a roadmap for access and affordability. These are tangible goals. These are bold goals, but I am confident with the team that we have in place that we have been able to recruit. Even in just the past year, we've recruited approximately 19 new team members, all, as JT had mentioned, top-notch, top caliber team members. And we will be growing other parts of the organization to achieve these goals. With that, next slide, please. I want to, first of all, thank all the members of the CIRM team who have been instrumental in being able to deliver this plan in a very short time frame. To all of you as members of the board, because you will see all throughout the document, your fingerprints, your input, your wisdom are all embedded in the strategic plan. But I'm now requesting for board action approval of the proposed CIRM 5-year strategic plan that will enable our team to create concepts and programs to be brought to you in the upcoming years. And I'll now turn it over to Chairman Thomas, who will take questions, and I'm happy to address any questions you may have about the plan. Thank you.
Mr. Chairman.
JT, you're on mute.
Mr. Chairman.
Yes, Mr. Senator.
Yes, I would like to introduce a motion to approve this proposed CIRM 5-year strategic plan, and also to add a thank you to Maria and the incredible leadership team that she has put together and has been part of this process, as well as input from many of our board members. This is a very impressive document, and I think that once we start distributing it to people outside of CIRM, especially in the legislature and constitutional offices, I think will be viewed even with much more respect as to the seriousness by which we've taken the taxpayers' mandate to make sure that we run this office efficiently, this agency efficiently, and making sure that the patient is foremost in our agenda.
Second.
Thank you. Is there, do we have a, before we get on further comments, do we have a second to the motion?
Yes.
Second.
Who was that?
Dave Martin.
Thank you.
Thanks,
Dr.
Dave.
Martin.
Yes, thank you. I'll have a comment, one and a question for Maria. So the comment is just to reiterate that Maria started this process with the leadership team back in March of 2020 without knowing at that point for a number of months whether CIRM would even be around for an additional 5 years, but nonetheless took major action and initiative to begin the discussion with the full panoply of stakeholders to get everybody's input and allow for an exceedingly well thought out process, which everybody was able to address over many months, and that has led to this this exceptional document that we have here before us. So, Maria, and to you and to the leadership team, thank you for pressing on with this at a time where things were very much up in the air. Yet that action has directly benefited the agency and patients by ending up with a very thoughtful and deliberate document that we have here before. So that's my comment. My question, Maria, is if you could, for the board's benefit, there are a number of programs that are set forth in Prop 14 that are either new or reconstructed older programs that are going to be brought before the board over time to implement. Could you just give the board a sense of sort of what the rollout's going to be of some of those elements?
Sure, Chairman Thomas. First, I want to thank you and Senator Torres for your kind comments. And I wanted to reiterate, we do have the right team in place, and that's why we were able to deliver this plan. Now, in terms of your question, I'll just start with the specific elements that were stipulated in Prop 14, and I'll start with that, but it actually lines up very well with some of the things we're thinking in the rollout. You will hear from Ms. Simpson, Pune Simpson, later today, the administrative as well as the research budget. We will, in the upcoming 6 months, start to launch this new strategic plan upon your approval, of course. And one of the first programs that we expect will roll out is the Alpha Clinics expansion program in the early 2022. After that, in the course of the ensuing year, we expect that we'll be rolling out one of the first competency hubs called the Shared Labs, which also is stipulated in Prop 14. Also within this upcoming year, we do believe, it's not specifically specified in the proposition, but it's essential, is to roll out the manufacturing network proposal, because we know that our programs need that. And then over the course of the next year or so, to really gain better intelligence and more information so we can start crafting what the community care centers of excellence would look like. At the same time, we will be recruiting a whole new department of medical affairs and policy that will be critical in working to support the AAWG, its priorities and initiatives, as well as implementing and informing the best direction for the Alpha Clinics network and the community care centers of excellence as the so-called laboratories where we need to figure out the best way to provide access and assistance for patients to truly gain access to, and broadly access all the communities underserved, as well as all those in need. So that's kind of what it looks like. You will expect to see more education-related programs to build on the on-ramps as discussed, as well as in the early part of 2022, you will see a basic discovery, at least discussions of them that will be brought mid-year to late or so to the board, maybe even a little earlier. I'll have to defer to my team because they're better at keeping the timelines. There's so much going on with basic foundational discovery, because currently our discovery program that is open for accepting applications is called candidate discovery, which means that the nature of those types of grants is that there is it's for discovery research related to therapeutic development, but there is an important role for foundational and mechanistic discovery research, basic science research, to better understand the biology and disease mechanism. So we will be reopening this discovery called DISC Zero program announcement early in 2022. In any case, that's kind of just a basic understanding. We will, as time goes on, the CIRM team will make sure that the board is well informed in the process that we usually undergo to make sure that we engage with board members appropriately in the subcommittees prior to bringing concept proposals and budgets to the full board. So it will be another busy year next year.
Thank you. Isabel.
Thank you, Mr. Chair. Maria, JT has said it well and said a lot of what I can recommend, what I commend you for, a very strong plan. I think, and I even heard you say it in these last comments, I think what concerns me most is what has always concerned me, and that is a lack of words here. I see the word diverse, and that can mean many things to many people. I would like to see more specific language, and perhaps, and forgive me if I was MIA during the strategic plan writing and I didn't add comments. So slap me with a wet noodle for being absent on that. But I'm really concerned that without specific language that references the inclusion, the equity and inclusion of racial, ethnic, and underserved populations in the language on the piece of paper, that those who do not consider these aspects see the word diverse and think they have taken care of the issue. So I am wondering if and I would still vote approval, if we can't strengthen the language on the paper that shows how committed and intentioned we are to make sure that, in fact, when we say all Californians, we mean all Californians, and we're very specific about who those Californians are so that they themselves read this and know it includes them. So I'm just looking for some sharper language that we can add within the plan. So when it hits the legislature, they see it as well and know that we are referencing all of our Californians, and particularly some of our most vulnerable and underserved communities, and that they have to step up to the plate and support this as well. That they can't get away with just the word, it's diverse. We're serving the diverse population of California. To me, that's not good enough. The community centers are fabulous, but let's make sure that the communities know that those are for them. So inclusion and words are so important in this day and age. We have seen words misused over and over and over again during this period of COVID, and we need to explain ourselves very clearly, very deliberately, and very intentionally. And so I hope that maybe you can add some words or phrases to this at the very beginning that expresses and repeats our commitment to diversity, equity, and inclusion. Thank you.
Thank you, Isabel. I took some notes, and we very much welcome those additional words, and we'll incorporate them. I do believe we do have words such as underserved, etc., but we will definitely strengthen them, because if you who look for these do not see them, then we clearly haven't done enough to make sure that it's very clear. So we will definitely be receptive of those additional words, and it's an electronic format, so that's something that can be incorporated. Thank you very much.
Thank you, Isabel and Maria. I think Senator Torres has some thoughts further on this theme. Art?
Art, you're on mute.
I'm sorry. I introduced Maria to the Chancellor's office at UC Merced, and they're in communication already with not only talking about diversity, but how do we establish a community care clinic and shared labs at UC Merced, which, as you know, and Adriana knows especially, covers an incredible part of North Central California, which is so in need of medical facilities and resources, and would be a perfect location for potential clinical trials, which would increase our diversity range. Number two, we had our first inaugural meeting of the working group on affordability and accessibility December 1st. Thank you, Kevin, Marks, and Maria for helping us write the bylaws, which were adopted at that time and which will subsequently be adopted by the full board. But we also talked about just where we're going. And so that you all know, of the 17-member board, we have many of our board members who are on there: Dan Bernal, Al Roulette, Adriana Padilla, David Higgins, and Allison Bashir had to resign because she left as the dean of UC Davis. But JT was very thoughtful in getting Dr. Pat Levitt from a Children's Hospital in Los Angeles to take Allison's position. So we have some good representation in the children's healthcare field. Ted Goldstein, who has really developed the program for Java, and has been working with Blue Anthem, now resigned from there so that he could work with us without a conflict of interest. And also James Benedetti, that I brought over from Covered California. You also need to know that as a board member there, we have 5 board members. We're embarking on an affordability, accessibility dimension to our negotiations with third-party payers. So we're moving in conjunction, this working group, and hopefully with Covered California, excuse me, in that area. I'm also happy that Adrian Shapiro from the Sickle Cell Advocacy Group is also on this working group, and David Serrano-Sewell, who was a former board member of CIRM and co-led the effort to establish the initial stem cell labs across the state. He's going to be very important as we consider the edification of community care clinics. And of course, Dana Goldman, who wrote the economic impact report from USC as a dean there, on our contributions to the state of California as an agency. And lastly, my good friend, Dr. Harold Harlan Levine, who heads up business strategies as president of the City of Hope, has agreed to come on board as our patient navigator. So we have a very impressive group of 17 people. And I think that as we move forward, we're going to be in conjunction with a number of state and federal agencies that are moving in similar directions. And I hope to work very closely with my former chief of staff, who is now the Secretary of Health and Human Services, Javier Becerra, to make sure that we are in sync with federal policies that will help us implement our mandate to create affordable, accessible, diverse access for clinical trials, especially for patients in California. Thank you, JT.
Thank you, Art. George.
Yeah, thank you. First of all, I'd like to thank Maria and the entire team for creating this document, which I think really sets forth an exciting future for CIRM and for stem cell research and development in California. I think it's a great document. And and yes, I do support Isabel's suggestion. I think that would be a very helpful modification. My question really relates back to the previous strategic plan for CIRM. When I think back on the previous plan and perhaps the outgrowth of the previous strategic plan, there were very specific numerical goals that were set for achievement. You could almost think of them as accountability measures, but a set of very specific goals that we discussed periodically in our board meetings as a result of the previous plan. Is there a plan to establish similar goals for this plan, and kind of how do you see that developing?
Thank you so much. It is worked into what absolutely how we operate at CIRM. So we take the strategic plan as our framework. We create annual goals, which are measurable goals. And then from those annual goals, each team creates quarterly goals that are measurable. And these goals build upon achieving the annual goals that then roll into the 5-year goals. What you're referring to is in the past strategic plan, we had what we call the big 6 goals. So we said everything was 50, right? 50 new clinical trials, 50 new candidates, 50% of programs partnered. We will have something similar. The past strategic plan was very operational. It was setting up systems. This strategic plan seeks to create really novel models. But we do still believe there's an opportunity to create measurable metrics related to the advancement of the strategic goals. Thank you for the question. That is something that is embedded in how we operate at CIRM. In fact, this week we have what's called an all hands meeting. We have quarterly all hands meetings, and as a team, we're able to assemble and give updates. And as well, each team, each group present an update on how they did against the past quarter's goals, and then commit to the next quarter's goal. And it's a really great event, in the times, prior to the recent, to assemble, to really understand how the goals relate between the groups, how things are going, and to really become informed of how we're all moving, in the same direction toward achieving the strategic goals according to the mission. Thank you so much for your question.
Thank you. Thank you, George. And Maria, if you could just on an annual basis, perhaps revisit with your goals with the board so that they know what is lying in the future for the ensuing year. That would be very helpful.
Thank you, JT. I think that's a great suggestion, and I intend to do that in the president's report. Thank you.
Al from Berlin, Willkommen.
I wanted to acknowledge, Maria, the process. As JT indicated, it is very challenging to develop a strategic plan when you don't know if the organization is going to go forward. And in light of that, your process was quite inclusive. And the outreach to other board members I found to be very, very helpful towards my participation. I wanted to acknowledge the staff's work. And for fear of repeating some of the other wonderful things that have been said by our chair and our vice chair, again, congratulations on the plan. And then lastly, I, as always, endorse Isabel's assertions regarding DEI and any effort to be more deliberate, and perhaps not the best word, but as we can be more effective in the incorporation of DEI language in our strategic plan, sending a message to the citizens and the individuals that benefit from the organization that the true intent of CIRM and the goals of CIRM regarding coming up with cures that change the trajectory of lives of the people that voted for the proposition and those that didn't support the proposition. That makes a difference to me, changing the trajectory of their lives. And I think our strategic plan does a great job at it, at really improving the overall communication to those individuals in our organization. Again, well done. Thank you for your efforts at including me and other patient advocates in the development of this plan.
Thank you so much.
Any other comments from members of the board? Do we have any comments from members of the public?
I don't see any hands raised.
Okay, Maria, then will you please call the roll?
Lauren Alving,
Present.
This is a yes or no vote.
Yes.
Thank you. Kim Barrett,
Yes.
Dan Bernal,
Yes.
George Blumenthal,
Yes.
Michael Botchin, Linda Boxer.
Yes.
Thank you. Leander Clark Harvey, Deborah Deese,
Yes.
Anne-Marie Dulege,
Yes.
Isabel Duron,
May I say yes with reservation?
how about we'll just count it as a yes?
I just want to see the uptick in language or the change or yes. All right.
Noted, thank you. Mark Fisher Colbury,
Yes.
Fred Fisher, Elena Flowers,
Yes.
Judy Gasson,
Yes.
Larry Goldstein,
Yes.
David Higgins,
Yes.
Steve Julesgart,
Yes.
Rich Lahara,
Yes.
Pat Levitt, Linda Malkus, Dave Martin,
Yes.
Shlomo Melmed,
Yes.
Christine Miskowski,
Yes.
Lauren Miller Rogan,
Yes.
Adriana Padilla,
Yes.
Joe Panetta,
Yes.
Al Rolette,
Yes.
Barry Selleck,
Yes.
Michael Stamos,
Yes.
John Thomas,
Yes.
Art Torres,
Aye.
Christina Vori,
Yes.
Carol Watson.
Yes.
Thank you. The motion carries.
Thank you, Maria. That was about as unanimous as you can possibly get. Dr. Milan, thank you so much again to you and your team. Congratulations. And we look forward to implementing the plan going forward and to taking CIRM to the next great level.
Thank you, Chairman Thomas, and to the board for your support.
Okay, Beth, how are you doing at the moment? Beth, hear us, Maria?
She's on mute, so she may not realize that. But I think if she hasn't said anything, oh, there she is.
A break will be fine anytime you choose. It works
Okay.
for me, whatever you like.
Okay, well, let's just get very quickly through the next 2-second item here. So we have a consent calendar, as you can see from the agenda. We have 3 items on that: consideration of the Science Subcommittee mission statement, consideration of the Finance Subcommittee mission statement, and consideration of minutes from X number of months before today. We have the fact that these are on consent isn't certainly with respect to items 5 and 6, any statement on the amount of time that was spent. There was considerable discussion on these items, but it was felt that these could be consent items. So before we get a motion on the consent calendar, are there any items that any members wish to remove from the consent calendar itself? Okay, hearing none, do we have a motion to approve the consent calendar?
So move.
Moved by
That was George.
Blumenthal. Is there a second?
Second.
Second.
Okay, Maria, did you get
And
that?
I think it was Kim was second. Is that correct?
Yep.
Thank you.
Okay, moved and seconded. Any comments by members of the board? Any comments by members of the public?
There are no hands raised.
Thank you. Maria, will you call the roll?
Lauren Alvin,
Yes.
Kim Barrett,
Yes.
Dan Bernal,
Aye.
George Blumenthal,
Yes.
Michael Botchin, Linda Boxer,
Yes.
Leander Clark Harvey, Deborah Deese,
Yes.
Anne-Marie Dulege,
Yes.
Isabel Duron,
Yes.
Mark Fisher Colbury,
Yes.
Fred Fisher, Elena Flowers,
Yes.
Judy Gasson,
Yes.
Larry Goldstein,
Yes.
David Higgins,
Yes.
Steve Julesgard,
Yes.
Rich Lahara,
Yes.
Linda Malkus, Dave Martin,
Yes.
Shlomo Melmed,
Yes.
Christine Miskowski,
Yes.
Lauren Miller Rogan,
Yes.
Adriana Padilla,
Yes.
Joe Panetta,
Yes.
Al Rolette,
Yes.
Barry Selleck,
Yes.
Michael Stamos,
Yes.
Jonathan Thomas,
Yes.
Art Toros,
Aye.
Christina Vori,
Yes.
Carol Watson.
Yes.
The motion carries. Thank you.
Thank you, Maria. Beth, I want to do one more item because it is related to what we just voted on, if you'll bear with us a bit longer here. So we're going to take, since we just adopted the Science and Finance Subcommittee mission statements, I'm going to move item 14 up, which is an action item, which is of IP and Industry Subcommittee mission statement for a discussion here, and I'll turn this item over to Mr. Julesgard.
Thank you, Mr. Chairman. Can we display the new proposed IP and Industry Subcommittee mission?
Yes, Doug has that. Yeah, Doug has that to display. He'll be putting that up.
All right, thanks.
Mm-hmm.
So let me just give a little background before we kind of get to the mission statement. When I joined CIRM back in 2011, really the involvement of industry was fairly meager. There was a reference to Jaren's involvement early on at that point, earlier when we were talking about Oz. But it was far and few between as far as companies in the pharmaceutical or biotech industry go who were involved in the regenerative medicine space. That has changed remarkably and decidedly in the intervening years. And when we've added on gene therapy as an additional area that we will consider for funding, it's also greatly increased the involvement of industry. So there is a lot more interest these days in industry, in the regenerative medicine space and in gene therapy. And we're seeing that in the increased number of applications for funding that we're seeing. So as a result of that, when we met, we talked about that changed circumstance and what that might mean for this committee and then ultimately for the organization itself. And I want to basically focus on the proposed mission statement, not so much the historical one. So there were, the first thing we did was we added, and you'll see that outlined in number 2 in the proposed statement, the notion that there will be the possibility of disputes coming down the road as we continue with this organization in dealing not only with industry, but also with academic centers, et cetera. Usually when money's on the table, that is when not when money's going out from CIRM, but when it's supposed to be coming back, the issue of whether or not we have intellectual property covering products that have been produced, which involve CIRM funding and things of that sort will begin to show up. And so one of the things that we thought would be advisable is to have a subgroup of the board, that is this committee, be involved in overseeing those sorts of disputes and their ultimate resolution or disposition. Obviously, those things would be brought to the attention of the board as they at the appropriate time, but somebody needs to kind of help guide management's approach to dealing with these disputes. The third one was especially important to me. And that is now that we reflect on the fact that industry is much more involved in the regenerative medicine space and in gene therapy, I think it's time that we embrace industry more than we have been. They're going to be our partners, or we should make them our partners going forward in so many of the things that go on in bringing products to patients. Industry is very good at phase 3 clinical trials, at regulatory filings and regulatory approvals, at establishing a marketplace for a product, all of those sorts of things. That's where their expertise lies and where CIRM's doesn't. In any event, so the notion of number 3 is to more willingly become involve or I'm sorry, invite industry into the great CIRM tent to work with industry on those areas where they can really lend value. So I'll just pause right there, see if there are any questions. And if not, I move that, well, even if there are, I move that this mission statement, proposed mission statement be adopted.
Second. Steve, I have just a comment just to add on your point 3 there that as we all know, in the very early days, the overwhelming percentage of grants went to academia. The ratio of academia to industry has been steadily reducing, and at this point now, I think we're over 40% of our awards are going to industry. So this is a particularly salient point here that Steve raises, and definitely warrants new and additional attention. Are there any comments by members of the board on the motion? Any comments from members of the public?
I see no hands raised, JT.
We have a comment from Dr. Milan.
I couldn't let this time pass without just expressing how instrumental board member Jules Gard's leadership and input has been in the matters that are outlined here in this mission statement as a single person. Just dealing with so many complex aspects of how we can best support our programs while maintaining the interests of our California stakeholders, with his expertise in terms of just industry, in terms of drug development, and how this and intellectual property and how all this combines. So it's a really exciting time. I also want to highlight that bringing on our general counsel, Kevin Marks, along with Ben Huang, who's been here at CIRM, to support this effort is really going to bring us, I think, to really exciting times and so I wanted to just make that comment because I wanted to express that gratitude and acknowledge board member Jules Garb for all that he's done for the CIRM team and really helping us to address important matters and the topics raised here in this mission statement. Thank you so much for that time.
Thank you, Maria.
And I second Steve's motion.
Yes, sir. Thank you, David. David Higgins, you have your hand up.
I didn't mean to. I'm sorry.
It's nice to see you've made it to your place there.
Yes, I just got it. Walks in the door. Yes, thank you.
Okay. Any other comments by members of the board? And as I understand, no more comments from members, or no comments from members of the public. So with that, Maria, will you please call the roll?
Lauren Alving?
Yes.
Kim Barrett?
Yes.
Dan Bernal?
Aye.
George Blumenthal?
Yes.
Michael Botchin? Linda Boxer?
Yes.
Leander Clark Harvey? Deborah Deese?
Yes.
Anne-Marie Dulege?
Yes.
Isabel Duron?
Yes.
Mark Fisher Colbury?
Yes.
Fred Fisher?
Yes.
Elena Flowers?
Yes.
Judy Gasson?
Yes.
Larry Goldstein?
Yes.
David Higgins?
Yes.
Steve Julesgaard?
Yes.
Rich Lahara?
Yes.
Linda Mulkis? Dave Martin?
Yes.
Shlomo Melmed?
Yes.
Christine Miaskowski?
Yes.
Lauren Miller Rogan?
Yes.
Adriana Padilla?
Yes.
Joe Panetta?
Yes.
Al Rolette?
Yes.
Barry Selleck,
Yes.
Michael Stamos,
Yes.
Jonathan Thomas,
Yes.
Art Torres,
Aye.
Christina Vori,
Yes.
Carol Watson.
Yes.
The motion carries. Thank you.
Thank you, Maria, and thank you, Steve, for all your hard work. Double echo what Dr. Milan said for everything you contribute in all these and other matters. So thank you. Okay, Beth, how much of a break would you like here?
About 5 minutes.
Okay, so it is 10:46. So how about we come back at 10:52 to give Beth an extra minute of her time. Okay, we'll take a break and resume at 10:52 on the nose. Thank you.
Thank you, Mr. Chairman.
Hi. You have to unmute yourself, JT.
Good to go.
Is everyone back? Do I see your smiling faces? Yay.
Is Beth's smiling face back as well?
Not sure. Beth, let us know when you're back. Well, she's not there. She didn't know I said that. So that was completely useless.
I am back.
Excellent. Thank you, Beth.
Okay.
I want to make sure Gil's ready because he's next on our agenda.
I am ready.
There you are. Thanks, Gil. Okay, JT, I think we're good.
Okay.
At least I hope so.
Now resuming the action item portion of the agenda, we're on item 8, consideration of increase to the Education 3 summer program to accelerate regenerative medicine knowledge awards program budget. Dr. Sobrano will present.
Okay, thank you, Mr. Chairman. Good morning to everyone. I am hopefully sharing my screen and you can see the slides. So this will be a relatively short presentation. So back in May of this year, the ICOC approved the concept plan for our Spark training program, which is a high school summer research experience program, so that we could launch the call for applications. And so just as a reminder of what the Spark program is, this is an internship program that we have now supported 2 iterations of. The objective is to provide high school students with hands-on training in stem cell research through summer internships and to really try to inspire them to pursue science in general, but most specifically stem cell and regenerative medicine. And so the students get an opportunity during the summer to participate in labs as well as get other supplemental type of training and experience. And so this program was launched. The concept was, once it was approved to support up to 10 awards with a total budget of $5.1 million. And so now the applications have been submitted. They have been reviewed by our grants working group. And so it turns out that the grants working group recommended 11 applications with a total applicant request of about $5.33 million. So the difference between the amount that was allocated, shown in the funds available, versus the amount that is in the recommended for funding is a difference of $232,462. Now, the application review subcommittee in the next item before the board is going to determine which applications to fund under this program. However, making this budget adjustment by the full board would allow the application review subcommittee the maximum flexibility to fund all the recommended applications if they feel it's appropriate and desire to do so. And so our request then is to increase the allocation to the 2021 Spark training program from the $5.1 million to $5,332,462 to support up to 11 awards. So that is our request, Mr. Chairman.
Thank you, Dr. Sobrano. Do we have a motion to that effect?
So moved.
Moved by David. Do we have a second?
Second.
Was that Dan? Thank you.
We have a motion and a second. Do we have any comments or questions on this item from members of the board? Hearing none. Do we have any public comment, Maria?
We do not.
Okay.
Quick clarification. Sorry. if,
Dr. Stamos, yes.
yeah,
No.
sorry, if the
Michael,
committee ends up,
Michael, you have, oh, okay. Is it a general comment?
yeah, it's a general comment.
Okay.
That's all. The question is if the committee decides only to award 10 versus 11, because that's in their purview, will then the budget necessarily reduce back to what it was approved at previously?
Yes.
Yes, it would. So any remaining funds from any program that comes under the budget, the remaining amount goes into the unallocated pool.
Any other comments or questions? Maria, will you please call the roll?
Yes. Dan Bernal,
Aye.
George Blumenthal,
Yes.
Leander Clark Harvey,
Yes.
Anne Marie Dulege,
Yes.
Mark Fisher Colbury,
Yes.
Fred Fisher,
Yes.
David Higgins,
Yes.
Steve Julesgard, Steve, Rich Lahara,
Yes.
Dave Martin,
Yes.
Lauren Miller Rogan,
Yes.
Adriana Padilla,
Yes.
Joe Panetta,
Yes.
Al Rolette,
Yes.
Jonathan Thomas.
Yes.
Motion carries.
Thank you, Maria. On to item number 9. Following on item number 8, consideration of applications submitted in response to Education 3 Summer Program to Accelerate Regenerative Medicine Knowledge Awards Program Budget. Dr. Sombrano, and when you're making the presentation, could you please note which of the proposed awardees are new programs for the Spark program? Thank you.
Certainly, I can do that after they are approved, assuming they are approved. So I am sharing a new slide deck, which I hope you can see. So this is the recommendations from the grants working group related to the CIRM Spark training program. Just a reminder that this program belongs within our education pillar of the 5 major pillars that we continue to fund and support. You have seen already this year applications that have come through and been approved for the research training program that supports the pre-postdoctoral and clinical fellows, as well as the Bridges program that supports undergraduate and master's degree students. And so awards for those 2 training programs have been approved. So today we're seeking approval for recommendations related to the Spark program, which is our high school summer research experience. I just showed you this slide in the previous presentation. And also just to note that the program takes off of what was originally the Creativity Awards that began in 2012. So we've been supporting this program since 2012 at various institutions throughout California. There have been 10 programs across California that have been supported over the course of several years. There are 7 that are currently active in Northern and Southern California. So the program is one that we have felt has been successful in what it intended to do as it was created under those first 2 iterations. We have had about 530 students complete their internships since 2012. And some of this data here is what was presented during the concept presentation, but I think maybe worth highlighting again. Of trainees, many of these are still in high school, but of 171 alumni who reported college attendance, we had about 40% that were attending or attended a UC school, 26% that attended another California school, such as Stanford, Caltech, or a California State University. 33% of the students went on to schools outside of California, including institutions such as Yale, Columbia, Harvard, Johns Hopkins, Duke, and Princeton. Of the 141 declared majors, 96% were in biology or some other STEM related field. So the vast majority going on into science careers. This is a graphical representation of some of that data that I just presented in terms of the California college distribution of the students who reported where they were going, as well as those who were outside of California, many attending Ivy League schools or other prestigious universities after high school. So for the 2021 program, there are some updates that we made to the program, including expanding the allowable scope of research that the interns could participate in to include not just stem cell science, but also gene therapy and other related regenerative medicine research. We allowed institutions to partner with other organizations to increase the availability of host laboratories, as well as the diversity of those laboratories in terms of the opportunities for gene therapy and stem cell science. We provided more formal requirements to maintain and strengthen the focus on diversity, equity, and inclusion. So what this means is having them develop a specific plan for how they're going to recruit and include underrepresented and underserved students and bring them into the program. Also to require an alumni tracking plan, which is critical in assessing the program over the course of time, both to help them identify gaps in their program, elements that they need to improve in order to move forward. And then we also changed the budget structure to increase the award amounts to reflect the present economy and to afford more flexibility for recruiting and appointing a diverse cohort that includes socioeconomically disadvantaged students. The scoring system that the grants working group used in assigning merit to these applications was on a scale of 1 to 100, with a score of 85 to 100, meaning that they would recommend for funding if funds are available. The review criteria that were utilized to assign the score were the following 4 key questions. First, does the proposed program hold the necessary significance and potential for impact? Is the training program well planned and designed? Is it practical and achievable? And does the program have a track record and outcomes of a prior training program that has demonstrated success? So this is a summary table of the recommendations from the grants working group. As mentioned earlier, there were 11 applications that were recommended for a total applicant request of $5.33 million. There were 3 that were not recommended for funding. So our CIRM team recommendation is to fund all 11 projects that have a score of 85 or greater. And so that concludes my presentation, Mr. Chairman.
Thank you, Dr. Sembrano. Before we get to comments, do we have a motion to approve?
I move.
Moved by Anne Marie, seconded by?
Second. Fred.
Fred.
Thank you, Fred.
Great. Okay. Moved and seconded. Comments, questions from members of the board? Isabel.
You're on mute as well. Oh,
Yes,
okay.
thank you very much, Mr. Chair. I'm not allowed to talk about this program, but what I really would like, Gil, is for us to also include the demographic breakdown of the participants who have been in Spark. I love the pictures, etc., but I think given there are many high schools who do not and barely teach basic sciences, and kids aren't tracked towards STEM programs and don't know that they can become these scientists of the future who don't even know if they understand what STEM is. I would like us to be able to show examples of success from these communities. I would love to always be able to talk about Spark and the numbers of kids of color who are coming out of vulnerable populations and low-income communities. So I would love if you could show in the demographics or in your list of all of these wonderful things about these participants, if we can also get a demographic breakdown. I think that would help all of us in talking about Spark wherever we go and to whomever we speak, why this shows a real big accomplishment for CIRM, that we are getting kids from these vulnerable populations into the mainstream of science and becoming hopefully our future scientists and researchers. Thank you.
Thank you, Isabel. Gil, do you want to comment on that?
Sure. I think that's a great suggestion, and it is and does align with what we intend to do. I think over the last two iterations of this program, that was not a specific requirement that we had. So I think the data that we have for that program is a little bit sparse in terms of race, ethnic, and gender diversity. But under these programs that we're hoping to fund, the requirements have increased. So our hope is that, even within the first year, we will be able to have better reporting across the different programs in terms of who is coming into the program and better outcomes as the programs progress. One of the other things that I think came out of the grants working group meeting was that they observed, and you may have seen it in the comments in the summaries, that some programs had better plans than others in addressing how they were going to target and recruit underserved members of the community into the internship program. And so the sharing of that information across programs is important. And so that is another element that we intend to incorporate to try to take best practices and good ideas from one program that may help others achieve the same thing or perhaps better. So thank you for your suggestion.
Thank you, Gil. I'll just note anecdotally, as everybody here knows, I've said it a bunch of times, this is one of my absolute favorite programs that we fund. It's the starting gate for building up the workforce pipeline, and the level of enthusiasm that these kids approach this program with, and the amount of knowledge they get out of it is truly remarkable. But the point I wanted to raise specifically here, Isabel, is I've gone to every Spark end of program celebration over the years, and it is without fail every year a remarkably diverse group of kids that have gone through the program. So it's something that the programs themselves have clearly sought to further, and but we absolutely, as always, appreciate your comments and see if we can continue to even increase that exposure going forward. Okay, Fred, I think you were next.
It was all along the lines of what we've been talking about. As we make our way to more effectively evaluating the DEI components of all the proposals, that priority exists here too. So I'm hopeful that in the future we can have data about access and inclusion of underserved or underrepresented students in this program, not just because it helps us talk about the program better, but it helps us evaluate the effectiveness of achieving that priority. And Gil, I didn't see, or maybe I missed it, on the review criteria that you listed, I didn't see DEI priorities listed as one of those review criteria. Did I miss it, or is it not yet there yet?
No, it's there. It's in the sub questions. So I just showed you kind of the high level summary of it, but it is definitely included. And I will add that, you know, the applications did ask for demographic information to be included. And so that was part of the evaluation. And as you may recall, there were many comments related to that by reviewers for many of the programs, some who did better than others in their approaches.
Yeah, so I wanted to just illuminate that for the other people in this meeting that may not have seen that or may not know that. So thank you. And if we could, a year from now, be reporting on that too, I think that would help.
Thank you, Fred. I think Adriana was next, then Anne Marie, then Deborah. So Adriana.
Yes, thank you. I just, I'm very happy to see the number of programs that are applying for this grant award, and I'm sure that they're all working very hard to recruit diverse students from their local areas. But I can't help but notice that it's all Northern California and Southern California, and nothing in the Central Valley or other areas of underserved locations in California. Is there anything in the review criteria, Gil, about reaching out to different areas that have not had the opportunity to put together programs to help the local students from these underserved areas of California?
So there's an opportunity for all the applicants when they submitted the application to bring in a partner that could be from anywhere. So that was part of it. But I think also they have the opportunity, once funded, to expand any partnerships. So it is something that we can certainly encourage programs that are funded to do as they expand their outreach and or think of strategies for outreach in order to bring in a more diverse set of students into the program. So it can certainly be a part of it. There are a couple of programs in there that are one in the Inland Empire and one in Central California that is included as well.
Okay, great. Nice to hear. Thank you.
Thank you. Anne Marie.
Yeah, so excellent presentation, Jill. Thank you, Gil. Thank you. And like you, Jonathan, and like all of us, we really adore this program. Gil, can you give us a rough idea of how many students do you think will be impacted by this new grant? We hear that there's 10 institutions. So how many students does this potentially represent?
So what we were targeting was about 500 with 10 institutions. So with 11, it would add maybe about 50 more. So about 550 interns over the course of this program.
Thank you.
Deborah.
Yes, I noticed in the selection criteria, one of the criteria was having a track record about outcomes. And I think this goes along with Adriana's comment. If that is a criteria, then we inadvertently, the unintentional consequence is those programs that have not had Spark would not have a track record, therefore would not rank highly to be accepted as a program. Am I correct on that?
So not necessarily. I think certainly having a Spark program previously helps, but the track record really is about any summer program that might be similar. So we have actually in this group of recommended applications, there are 5 new programs that have never had a Spark program before. And so many of them have an existing summer program. And so the track record is represented in those in terms of how they did, even though it's not necessarily or specifically Spark.
Okay, thank you.
Okay, are there any other comments or questions from members of the board? Any comments from members of the public? I just want to remind everybody, which I was remiss in, we are now in the application review subcommittee portion of the agenda. So the voters on this motion will be those members from that subcommittee. So with that, Maria, will you please call the roll?
Sure. And as a reminder, if you have a conflict, you would say yes or no, except for those with which I have a conflict. Dan Bernal.
Who's that? Oh, yes. Hi.
Yes, thank you. Anne-Marie Dulage.
Yes.
Isabel Duron.
Yes, except for those with which I have a conflict.
Mark Fisher Colbury.
Yes.
Fred Fisher.
Yes.
Elena Flowers.
Yes, except those for which I have a conflict.
Leandra Clark Harvey.
Yes.
David Higgins.
Yes. Yes.
Steve Julesgaard.
Yes.
Rich Lahara.
Yes.
Dave Martin.
Yes.
Christine Miaskowski.
Yes, except for those with which I have a conflict.
Lauren Miller Rogan.
Yes.
Adriana Padilla.
Yes.
Joe Panetta.
Yes.
Al Roulette.
Yes.
Jonathan Thomas.
Yes.
Art Torres. Carol Watson.
Yes, except for those with which I have a conflict.
Thank you so much. The motion carries.
Thank you, Maria. Thank you, Gil. And oh, Gil, are you now at liberty to answer the question I asked at the outset?
Yes, absolutely, Mr. Chairman. So yes, we do have 5 new programs at 5 institutions that include Charles Drew University, UC Riverside, UC San Diego, the Sanford Burnham Research Institute, and Children's Hospital of Los Angeles. And those are new, never before had a Spark program. So we certainly welcome them to that Spark overall program.
Thank you, and absolutely second that comment. Okay, on to now.
Excuse me, I was mute. Was I called on that roll call?
You were, Art.
Yes, you were.
So was I.
Thank you.
Except for those with which you have a conflict.
Except for those of which I have a conflict.
Thank you so much.
That Maria told me about.
Okay, on to item number 10, consideration of revised CIRM research budget for the fiscal year. And Pune is going to give a presentation, but Larry, would you like to frame this up as chair of the science subcommittee?
Sure. Thank you, JT. So in my role as chair of the science subcommittee, I met with Pune and other members of CIRM staff to discuss how some of the numbers were generated. In particular, as you'll see, the number for the translational grants. I'm satisfied that they used a rigorous approach. It then went to the science subcommittee, which approved it unanimously. And I guess the only thing I do want to add is that translational piece, is absolutely critical to getting interesting ideas and candidate therapies into human clinical trials. Those of you who've never done this may not appreciate just how difficult it is to make it from an interesting idea or reagent through the FDA and onto the initiation of trials. And so I think that the budget increase is warranted. Pune can, of course, answer any questions about the details. And I think at this point, let me just turn it over to Pune.
So good morning, everybody. I'm Pune Simpson, the Director of Finance. Thank you for the opportunity to present the research budget to you today. Just to get started, as a reminder, after the passage of Prop 14, the CIRM team presented a proposed fiscal year 21-22 research budget in June. The ICOC approved that budget with the understanding that a new concept proposal would be brought forth with the rollout of the 5-year strategic plan that Dr. Milan just presented. So today we're going to be presenting that mid-year budget proposal with the agenda of just first doing a recap of what the board approved in June and then presenting the mid-year budget to you. So with slide 3, we'll just get started with what was approved in June. The board approved $360 million in research grants, which we have applications in progress for this fiscal year. And now I'll present the changes that we would like to make to this. So I think it's slide 5. There you go. So in this chart, you see the different programs, pillar programs that we fund. And in column 2 is the budget that was approved by the board, $360 million. We're proposing an addition of $114 million as part of the mid-year, $34 million in translational grants, and $80 million in infrastructure grants. With regards to the $34 million in translational grants, the approved funding level for this category was previously benchmarked to costs in prior funding rounds. However, there was an increased trend in the first round of funding in October of this fiscal year. This mid-year adjustment supports additional grants for the second cycle in this fiscal year based on that increasing trend. The $80 million in infrastructure grants is the fiscal component of the programs anticipated in the strategic plan that Dr. Milan presented. So just to point out, the mid-year budget request will be followed by a more detailed concept proposal and grant details. And so finally, in the last column is the total proposed research budget that we're requesting for a total of $474 million. So today we're asking the ICOC to approve the $114 million increase. And I'll stop at this point to answer any questions. And if there aren't any, I'll move to the administrative budget.
Do we have a, Fred, hold on one second. Do we have a motion to approve the research budget?
I'll move.
Second.
You get both of those, Maria?
Yes, Fred and Christine.
Thank you.
Thank you.
Yes, Fred.
Are there specific priorities connected to the infrastructure budget? Or where would I find information about that?
So I'm going to defer to Dr. Milan on that.
As presented at the during the strategic plan, one of the major infrastructure programs that's likely to roll out first is the Alpha Clinics expansion program. And though we don't have an exact budget for that, that would be presented along with the concept proposal. This is an estimated projected budget that would allow us to support making active the application for that particular concept. Upon board approval, of course.
And just a quick follow-up, how does this compare to the infrastructure spending from the Prop 71 program?
So I can give you, that's begin with at the very outset, when we were building the various institutes, the 12 different institutes, which are either freestanding buildings or renovations of existing buildings, we spent about, I think it was 270 million on infrastructure in the early days. We've had since then a number of programs that have come under the term infrastructure, which are not brick and mortar, but are termed that for various reasons, which include the Alpha Clinics, the IPSC Cell Bank, and the Genomics Centers of Excellence. And I don't have an exact number off the top of my head, but it's tens of millions more on top of that. Gil, would you happen to have an idea on those latter three?
I don't, unfortunately.
Okay, but that's the scope of what. Yes, Pune.
No, it's Maria. So we spent in the the Prop 71 era, approximately 480 million plus a little bit more for infrastructure. And as JT had mentioned, a lot of that was in the early days of building the labs when those were required in order to conduct the research. And then the later programs were programmatic infrastructure, such as the Alpha Clinics Network and creation of IPSC banks for research and the Genomics Initiative, which was approximately in the $50 million range as a program infrastructure. This projection is based on benchmarks for what the Alpha Clinics, programs had received for funding in the past. And again, these will be more finely tuned in terms of, the actual budget asks once that concept is more ready to bring to the board.
Helpful, thanks.
And there will be no bricks and mortar investment into the expansion. This will be all program based.
Okay, thank you. Deborah.
Yes, my question was similar to Fred's. I wanted to sort of understand more about this infrastructure budget increase, and also trying to understand why an infrastructure line item budget wasn't included at the beginning. When we look at the mid-year adjustment, it's a third increase of the entire budget. So it's significant. And some of the comments made earlier answered my concern, but I just think in the future, when we're making mid-year adjustments, we need to more carefully delineate and explain upfront what they are, because this is a third of the budget increase is very significant for a mid-year adjustment.
May I comment, Chairman
Sure.
Thomas? So Dean Dees, we had already anticipated in June that we would be bringing a significant ask to this meeting because we did not yet have a strategic plan, which we just rolled out today. So this is an unusual year, and we don't typically have mid-year adjustments. We don't expect we will in the future years unless something unforeseeable happens. And it's really just related to the timing of the rollout of the strategic plan. And the fact that the infrastructure typically as a funding round tends to be a pretty hefty budget associated with it.
Yes, that satisfied my concern. I'm just pointing out that in the presentation, we need to clearly state that so the public understands it as well.
Thank you so much.
Thank you, Deborah. Fred?
Yeah, just quickly, since and I particularly appreciated Dr. Milan's last comment, which is the funding is not for bricks and mortar, which was really helpful and probably part of the question I should have asked in the first place, knowing how much bricks and mortar investment happened in the first era of funding, that maybe at some point we come up with a new name for what this is, because it really is programmatic. It really is direct service. Those Alpha Clinics they are there, they are helping people, they are providing services, they are running clinical trials there. So it's really, infrastructure is kind of a counterintuitive word to describe what is actually going on. And it's probably in everybody's best interest that we find a label for it that actually helps people understand what we're spending the money on.
Thank you, Fred. Any other comments or questions from members of the board? Is there any public comment?
No hands raised.
Hearing none. Maria, please call the roll.
Sure. Lauren Alving?
Yes.
Kim Barrett?
Yes.
Jen Bernal? George Blumenthal?
Yes.
Thank you. Michael Botchin? Linda Boxer? Leander Clark Harvey, Deborah Deese,
Yes.
Anne Marie Dulege,
Yes.
Isabel Dudon,
Yes.
Mark Fisher Colbury,
Yes.
Fred Fisher,
Yes.
Elena Flowers,
Yes.
Judy Gasson,
Yes.
Larry Goldstein,
Yes.
David Higgins,
Yeah.
Steve Julesgard,
Yes.
Rich Lahara,
Yes.
Pat Levitt, Linda Malkus, Dave Martin,
Yes.
Shlomo Melmed,
Yes.
Christine Miaskowski,
Yes.
Lauren Miller Rogan,
Yes.
Adriana Padilla,
Yes.
Joe Panetta,
Yes.
Al Rolette,
Yes.
Barry Selleck,
Yes.
Michael Stamos,
Yes.
Jonathan Thomas,
Yes.
Art Torres,
Aye.
Christina Vori,
Yes.
Carol Watson.
Yes.
Thank you. The motion carries.
Thank you. Renee, before you go on here, we're going to move another item out of order because it bears on the second budget agenda topic. So we're going to take item 17, which is consideration of ICOC patient advocate member compensation, up at this point in advance of hearing about and voting on the administrative budget, because this is an item that appears in the administrative budget. So I'm going to present on this. So a little bit of background here. When CIRM was first established by Prop 71, patient advocates were to be given a per diem of $100 for meetings that they made at that point. At the same time, we had an amount that went to the members of the GWG who were scientific members, which was dubbed a daily consulting rate of $750. And a few years went by, and after the passage of SB 1064, the patient advocate per diem was changed to a daily consulting rate with respect particularly to those members who were part of the GWG. And the board made a decision that the daily consulting rate for the patient advocates in that context should be 3/4 of what the scientific members were getting, or $562.50. The patient advocates play, in addition to an exceptionally important role, a considerable role that goes above and beyond the participation at the ICOC and subcommittee level. And so as years went by, while they were only getting compensated for the extra amount for the GWG, Bob decided in writing Prop 14 that the daily consulting rate for the patient advocates should extend to all meetings that they make as a sort of a makeup and reflection of the extraordinary commitment they make to the organization. And we now have layered on top of that, among other things, the participation in the AAWG, which is going to take up a lot of time for them. So the measure, as I say, increased the scope to which the daily consulting rate would apply. And it's now up to the board to vote on the amount of that daily consulting rate as more broadly applied. And as you see in the memo, which was prepared by James Harrison on the subject, the recommendation is that the $562.50, the going rate for the patient advocates as applied across the board for their participation in the various matters that we've discussed here. So do I hear a motion to approve? And by the way, patient advocates, since this applies to you, please if you would refrain from moving, seconding, commenting, or whatever. So do we hear a motion to approve?
Yeah.
Yeah.
I motion
moved.
or I second.
Anne-Marie moves. Was there a second I heard there?
Yes. Second.
That's Shlomo on the second.
Second.
I don't
Okay.
think there's time to be strong.
Like we're a lot of seconds.
By design, look at this.
David Higgins dog seconds. Now he's conflicted, so he can his picture on the screen there. Very handsome.
I can second.
I second. I second. Yeah.
Yeah, we got. I think Shlomo was first on the second. We got lots of seconds.
Okay.
No
So-
big deal.
So, are there any questions or comments from members of the board? Any comments from members of the public?
There are none.
Hearing none, Maria, will you please call the roll?
Lauren Alving,
Yes.
Kim Barrett,
Yes.
George Blumenthal,
Yes.
Michael Botchin, Linda Boxer, Deborah Deese,
Yes.
Anne Marie Dulege,
Yes.
Judy Gasson,
Yes.
Larry Goldstein,
Yes.
Steve Julesgard,
Yes.
Pat Levitt, Linda Malkus, Dave Martin,
Yes.
Shlomo Melmed,
Yes.
Joe Panetta,
Yes.
Barry Selleck,
Yes.
Michael Stamos,
Yes.
Jonathan Thomas,
Yes.
Art Torres,
Aye.
Christina Vori.
Yes.
The motion carries.
Thank you, Maria, and thank you all on behalf of the patient advocates. Okay, Pune, now we'll move on to consideration of revised CIRM, consideration of revised CIRM administrative budget for fiscal year 21-22. And before you start, I just wanted to have Al as chairman of the finance committee to, if you would, Al, just say a few words about this item.
I appreciate the work of Panay and the staff and the members of the finance subcommittee. We did meet and reviewed the presentation that's going to be presented to you. And after some discussion, it was approved unanimously.
Thank you, Al. Pune, please proceed to the presentation.
I'll be happy to. So we're going to be putting up the PowerPoint presentation with the administrative budget, and I will start with the agenda. Give a second for that to come up on the screen. Perfect. So with this budget, again, it's a unique year. So in the agenda, we're going to highlight two parts. First, the part that the ICOC approved in June and what the major drivers of that budget were. And then the second part, which is a mid-year revision that we're bringing to you today. So starting with what the board approved in June, again, this was a unique year. We typically just present the administrative budget once in June for a July 1 start of the fiscal year. However, because the strategic plan was being developed, we noted when we presented the budget in June that we would be coming back with some adjustments as a result of the strategic plan. So the budget that was approved by the board was the start of the launch of the Prop 14 initiatives, the development of the strategic plan, personnel building of the 9 positions that were approved by the board, and the increase in the number of reviews of the programs announced, and then an organizational restructure that was presented to the board in October, which is reflected in the departmental level budgets that were provided to you in the appendix. So that's kind of a overview of what was approved in June. And then I'd like to kind of move into what we're presenting to you as part of the mid-year budget in slide 6. So in slide 6, you have the different categories that we usually present our budget in the first column. The second column is what the board approved, $21.1 million as part of the 21-22 fiscal year. In the third column is the total that we're requesting the budget go to, a total of $23 million. And the fourth column is the variance in the different categories of what we're asking to increase or decrease. So in the next few slides, I'm going to provide some more details to you on what those increases and decreases are. So on slide 7, the very first category is the personnel services that drive our, there's 3 categories of increases, 2 categories of decreases. So in slide 8, I'm going to start with the employee expenses. Usually that is our largest category of increase. In this scenario, we're asking for an increase of 6 new positions in this mid-year budget that relate to the strategic plan launch of the new programs that are needed that Dr. Milan just provided an overview of, to manage the operational demands and the portfolio size of these new programs, and the personnel costs, which includes a base salary and benefits, which can be up to 45% of the salary. The second part of this category is the increase in patient advocate consulting per diem. So that's what the chair just went over. It's a requirement of Prop 14. The total in this category is 1.2 million increase, or 8%. And the next category of increase for us is external services. Here we have a couple of contracts that are needed to help us go paperless as part of the move and as part of being operational in a remote environment. And some savings were captured in this category in consulting services where we did not need to use the existing contracts. The net impact of that is an increase of $165,000, or 8%. The next category of increase is office expenses. In this category, we're capturing any costs of software upgrades or new software needed, equipment refresh, server and network refresh, media room audiovisual planning and modifications in the new office. The net increase is $720,000. And the next 2 categories are areas where we were able to find savings. So in the area of travel, obviously because of some of the restrictions of COVID-19, we were able to reduce in-person meetings and trainings and conferences for a net savings of $57,000. In the last category, we were able to recapture $154,000 in savings because one of our clinical program reviews went virtual instead of in person, and 2 of the reviews were postponed until next fiscal year. So finally, I would like to acknowledge that while we will be actively managing costs and maintaining expenses, there are external factors that could affect our projected budget plans. And those include potential move costs that we have not anticipated, timing and success of the recruitment of the positions that are being proposed, and then the effects of COVID-19 on travel and work activities. With that, I would like to ask the committee to approve the mid-year budget for administration, and I'm happy to take any questions related to that.
Sorry, thank you, Pune. Do we have a motion to approve before we
So
get
moved.
That was moved by
Michael.
Michael. Thank you, Michael. And
Second.
seconded by George. Okay. Do we have comments, questions? David?
Just a question about relocation. What was the motivation for relocating to South San Francisco?
I'll defer to our Chief Counsel.
Dr. Milan, would you address that, please?
Yeah, absolutely. And then I'd like to then refer this question to Kevin Marks, who's helping us in our facility search. So our lease for the Oakland office was up actually last year. We extended the lease by another year, and because it was a 1-year lease extension, it was at, it came at a premium. And so for fiscal reasons, and the reason why we extended that's because we didn't know what the outcome of the proposition would be. So it didn't make sense to move offices. So we decided that it was worth it at that point to stay put and then determine what the market looked like and what rents looked like when as soon as we found out what the output is or the outcome is of Prop 14. With the passage of Prop 14, we then embarked on an evaluation of whether we would stay there or look for new offices. And we set parameters for that the board approved. Chairman Thomas, Vice Chair Torres, and I have directed this search, and I delegated the lead on kind of the on the ground activities to Kevin Marks, who is here, I believe, on this call and is happy to answer any questions beyond what I just explained. Thank you.
Thank you.
Yeah, so in short, there were a number of factors that went into the evaluation of properties. And we looked at various geographic areas, including Oakland, San Francisco, and South San Francisco. We were looking at shepherding our fiscal responsibilities to the state of California and looking at an attractive cost option for the new office space. Our existing space, the proposal was drastically increased in the quotes that we received, which necessitated more of a move. We were also looking for a location that could better accommodate employee commutes. So all those factors went into the selection of property. We narrowed it down to about 4 properties that we advanced the negotiation on. We are in advanced stage of negotiations with one particular property, as you noted, in South San Francisco. The lease is yet to be executed, but we hope to do so shortly. Wow.
Thanks, Kevin.
JT, you're on mute.
Thanks, Kevin and Maria. Other questions or comments from members of the board? Okay. Comments from members of the public?
Nope.
Hearing none. Maria, please call the roll.
Lauren Alving, Kim Barrett,
Yes.
Dan Bernal, George Blumenthal,
Yes.
Michael Botchin, Linda Boxer, Leander Clark Harvey, Deborah Deese,
Yes.
Anne Marie Dulege,
Yes.
Isabel Dudon,
Yes.
Mark Fisher Colbury,
Yes.
Fred Fisher,
Yes.
Elena Flowers,
Yes.
Judy Gasson,
Yes.
Larry Goldstein,
Yes.
David Higgins,
Yes.
Steve Jules Guard,
Yes.
Rich Lahara,
Yes.
Pat Levitt, Linda Malkus, Dave Martin,
Yes.
Shlomo Mohamed,
Yes.
Christine Miskowski,
Yes.
Lauren Miller Rogan,
Yes.
Adriana Padilla,
Yes.
Joe Panetta,
Yes.
Al Rolette,
Yes.
Barry Selleck,
Yes.
Michael Stamos,
Yes.
Jonathan Thomas,
Yes.
Art Torres,
Aye.
Christina Vori,
Yes.
Carol Watson.
Yes.
Thank you. The motion carries.
Thank you, Maria. Okay, so we have 2 action items left, but they will follow one of the closed session items. And so what we're going to do now is going to adjourn into closed session, and I'll have Kevin read the closed session topics, and then we'll come out, we'll vote at that point on items 15 and 16. But before we do any of that, we purposely put this to the end of the meeting. So if there are members of the public who have comments on anything in particular they want to discuss, or wanted to give them the opportunity to do that before we go into closed session. Do we have any comments from members of the public on any topic of interest? Maria?
There are no hands raised.
Okay, thank you. So Kevin, will you lead us through the language as we adjourn into closed session?
JT, I thought we were going to take the break first and then we'll come back and go into closed session because we have to put everyone into a breakout room.
Well, I thought we were just going to read this and then have them go out, but whatever. Okay, so following Maria's lead, as always. So can we take a 10-minute break here for folks to get lunch? And then we will come back, and then Kevin will take us into closed session. So if you can get whatever and bring it back, this will be a working closed session with your lunch. So back.
Can we have the link now, or will we have it later? Or is it a different link?
So that's a Maria question. That's above my pay grade.
The documents, Anne Marie, I'm going to call you because others received the documents. So I'll give you a call right now.
Thank you. Thank you very much.
Mhm.
JT, how long is the break for?
10 minutes.
Hi, Fred. Is it just you and me?
I think it might be. My Zoom crashed and but they let me back in, which I felt was like a good sign that
Well, I can testify. I see you. You're present.
I'm not on video, but I'm listening in. Michael Stamos here. How are you?
Good. We hear you, Michael.
I'm also going to stay off video while I eat my lunch. So.
I was wondering if Maria, do we really think this is going to go till 4?
No, I think it'll be just a little bit longer.
Longer than 4.
No. Sorry, just a little bit longer from now.
Hey, Maria.
Oh, Fred.
How are we doing here, Maria?
I don't know. I see some faces. I see the same faces you do, so I'm not sure who's on and who's not.
Okay, so if everybody's within earshot, if you could start collecting here again. While we're doing that, I'm going to go off screen so I can eat a little myself. Maria, I'm having some of the white chili as we speak here.
Okay. So I think if you want to have Kevin read closed session language, and then Doug will bring us into a breakout room for just the board members for closed session. Kevin and I will also be in there. And then when we come out of closed session, we will resume business.
Mr. Chairman, whenever you're ready.
I'm set. Maria, do you see most back at this point?
Sure.
Okay. Kevin, please.
Mr. Chairman, members of the board, we'll now be moving into closed session pursuant to Government Code 11126, Subdivision A, and the Health and Safety Code Section 125290.30, subsection F3D.
Okay, thank you.
Doug, can you get everyone into closed session? Thank you. I'm gonna wait a few minutes to go in, just make sure everyone gets in.
Okay.
Linda, can you click on the join breakout room? Did you get that?
I didn't
Brett?
get it. I don't have it.
Okay. Doug, can you add some more of the members?
Yeah.
Got it.
Great. Fred?
Yeah, I haven't received it yet.
Yeah, I don't think I have either. This is David.
There it is. Leaving now.
Great. Tell her I'll be in just a couple seconds, Kevin. Okay, anyone else? Nope, that's it. Okay, I'll go into closed session as well, and then.
Maria, I don't think I have anything.
I sent it to you, David. If you can,
Okay.
just double check your Zoom.
All right.
It should
All
be
right.
out there.
Will do. Thank you.
Doc, what about Dr. Diaz?
She also received the link.
Okay, I see her here.
Are you there, Dr. D?
I think she's still coming back.
Am I out, Doug?
Yes.
All right, thank you.
Mr. Chairman, whenever you're ready.
Thank you. I believe everybody is back from closed session. We have 2 items left.
Excuse me, Mr. Chairman. I need to bring us out of closed session. So before we start, so sorry, we are now officially out of closed session. No decisions or action were taken by the board.
Okay, thank you. We have 2 items left on the agenda, which I'm going to turn over to Judy.
Thank you very much, Mr. Chairman. We are going to consider item number 16 first, and that is consideration of compensation for the CEO and president. The governance subcommittee has made a recommendation to the full board, which has been discussed. And I am asking now for a motion from a member of the board to go forward.
So I would like to make a motion to recommend 3% salary increase for Dr. Milan, retroactive to July 1st. This is a similar increase in salary as well as the timing as for the CIRM staff as a whole.
Thank you very much. Do we have a second?
Second.
Thank you very much, George. Any questions or comments from the members of the board? Hearing none, are there questions or comments from members of the public at this time?
There are no hands raised, Judy.
Maria, would you call the roll, please?
Lauren Alving, Kim Barrett,
Yes.
Dan Bernal,
Aye.
George Blumenthal,
Yes.
Michael Botchin, Linda Boxer, Leandra Clark Harvey,
Yes.
Deborah Deese,
Yes.
Anne Marie Dulege, Anne Marie.
Yes, yes, I'm sorry, I'm here. Yeah.
Thank you. Isabel Duron,
Yes.
Mark Fisher Colbury,
Aye.
Fred Fisher,
Yes.
Elena Flowers,
Yes.
Judy Gasson,
Yes.
Larry Goldstein,
Yes.
David Higgins,
Yes.
Steve Julesgard,
Yes.
Rich Lahara,
Yes.
Pat Levitt, Linda Malkus, Dave Martin,
Yes.
Shlomo Melmed, Christine Miaskowski,
Yes.
Lauren Miller Rogan, Adriana Padilla,
Yes.
Joe Panetta, Al Rolette,
Yes.
Barry Selleck, Michael Stamos,
Yes.
Jonathan Thomas,
Yes.
Art Torres,
Aye.
Christina Vori,
Yes.
Carol Watson. Motion carries.
Thank you, Maria. But now I'd like to move on to action item number 15, which is consideration of compensation for the ICOC chair and vice chair. May I have a motion, please, on the table?
I would like to make the motion to increase the compensation for chair and vice chair by 3%, retroactive to July 1st, similar to what CIRM staff received and at the same time.
Thank you very much. Do we have a second?
Second.
Thank you very much, George. Do we have comments from the members of the board? Hearing none, do we have comments from the public?
We do not.
Thank you very much, Maria. Would you call the roll, please?
Lauren Alving, Kim Barrett,
Yes.
Dan Bernal,
Yes. Aye.
George Blumenthal,
Yes.
Michael Botchin, Linda Boxer, Leandra Clark Harvey,
Yes.
Deborah Deese. Deborah? Anne Marie Dulege,
Yes.
Isabel Duron,
Yes.
Mark Fisher Colbury,
Aye.
Fred Fisher,
Yes.
Elena Flowers,
Yes.
Judy Gasson,
Yes.
Larry Goldstein,
Yes.
David Higgins,
Yes.
Steve Julesgaard,
Yes.
Rich Lahara,
Yes.
Pat Levitt, Linda Malkus, Dave Martin,
Yes.
Shlomo Melmed, Christine Miaskowski,
Yes.
Lauren Miller Rogan, Adriana Padilla,
Yes.
Joe Panetta, Al Rolette,
Yes.
Barry Selleck, Michael Stamos,
Yes.
Christina Vori,
Yes.
Carol Watson. Just one moment. I'm going to try and get Deborah. Are you on the line? Deborah, we need your vote in order to take action on this agenda item. I'm going to try and get a hold of Deborah. We need her. We need her to. For
Thank
this
you.
vote. You're welcome. Oh, she's entered the waiting room. Deborah?
Yes, I lost internet connection.
Okay, we just took the vote for the chair and vice chair, and I just need to record your vote on that.
My vote is yes.
Thank you so much. The motion carries.
Thank you, Maria. And I would like to now turn the meeting back over to Chairman Thomas.
Thank you, Judy. Thank you, Christina. Thank you, members of the governance subcommittee and members of the board for undertaking that difficult exercise. And thank you very much for the increase. Appreciate it. We have no further matters to discuss here as we dispense with everything else before we went into closed session. Would like to thank Marianne and Doug for all their help, and special thanks to Maria B. for orchestrating the meeting, herding everybody, juggling all the thousands of conflicts. No, just kidding. And really do appreciate all your help as always. To members of the board and members of the CIRM team, wish everybody a very happy holiday season. Judy, thank you for livening things up with Christmas garb there, the red and white, very Christmassy looking. We appreciate everything. I think it's been a very successful year on all counts, and we look forward to starting 2022 with our new strategic plan and our unparalleled CIRM family implementing it going forward to further accelerate the field. So with that, happy holidays to everybody, and we stand adjourned.
Thank you, everyone. Happy holidays.